Fisher.
Thank you, Mr Deputy Speaker. The federal seat of Fisher is home to many ex-service men and women. Our relaxed lifestyle and healthy environment, our strong community and our vibrant RSL sub-branches make the coast a perfect place to enjoy civilian life. But life after service for those who have risked all in the defence of their country can sometimes be difficult. A return to civilian life in and of itself, after the rigours and structures of a military life, would be a challenging transition for anyone. Like any major life transition, such a change leads to an increased risk of poor mental health. For many servicemen and women, however, this transition is made more difficult by the experiences they carry with them. For those who have volunteered to put their lives at risk, for those who have been away from families, who have seen friends and colleagues in danger or worse, or have seen some of the terrible impacts that conflict has on innocent people, those effects can be severe and lasting. In 2000, that clock hasn't stopped, Mr Deputy Speaker.
Just keep going.
Thank you.
We'll make a judgment call when you've...
Well, I'm happy to take up the time. In 2013, of the 148,000 veterans with service-related disabilities being supported by the Department of Veterans Affairs, 46,400, almost a third, were living with an accepted mental health disorder. These included post-traumatic stress disorder, anxiety disorder, depression and substance dependency. In too many cases, these conditions can have tragic consequences. Toward the end of last year, the government released the most statistically robust data on the prevalence of suicide among current and former members of the ADF ever compiled. The figures in themselves make for devastating reading. In the 13 years to 2014, there were 292 deaths by suicide among people who had served in the ADF for at least one day since 2001. 292 men and women who had done our nation proud and put their lives on the line to keep us all safe. Even one such death is too many, and no doubt these figures are an underestimation, as no data is available for those whose service occurred before 2001. When examined in more detail, however, the statistics reveal an even more alarming fact which needs to be urgently addressed. Among serving male members of the ADF, after adjusting for age, the suicide rate was 53% lower than the general male population. I can only speak about men, Mr Deputy Speaker, as the sample of women in the report was too small to create statistically valid results. Among men in the reserve, the rate was 46% lower. These figures are good news and testament to the ADF's work to support their soldiers through the most challenging and stressful environments. However, among veterans, ex-servicemen, the suicide rate was 13% higher than for the equivalent general population. The day, Mr Deputy Speaker, that a man leaves the armed force, his likelihood of death by suicide rises by 53% lower than others his age, to 13% higher. Worse still, if he is a young man aged 18 to 24, who has served and left the ADF, he becomes twice as likely as his peers in civilian life to die by his own hand. There have been 23 deaths since 2001 among this statistically small group alone. I know that the Minister has as keen an interest as I in seeing a solution to these problems. In my own electorate of Fisher, the government has recently committed $5 million to the Sunshine Coast Mind and Neuroscience Thompson Institute for research and treatment programs for youth mental health, suicide, prevention and dementia. I'm proud of what we're delivering and grateful to the government. As I've mentioned to the Minister before, though, my next goal in this field is to secure further funding to support a PTSD program at the Thompson Institute, and I look forward to working with him in the future to explore this possibility. Deputy Speaker, before I ask the Minister a question, can I mention that if anyone watching or reading this speech is worried about how they or someone they know from the veterans community is coping, I urge them on behalf of all members to seek help early. The Veterans and Family Counselling Service is a perfect place to start to find support, and they can be reached 24 hours a day on 1800 011 046. Now, I ask the Minister, what is the government doing to support the mental health of veterans of the ADF, and what action is the government taking in the area of suicide prevention for these men and women who have done their country proud?
The question is that